Just ahead, Governor Rauner holds a press conference to discuss the spread of Legionnaires Disease at the Quincy Veterans Home and his administration's cooperation with the CDC to eliminate the infection. This runs about 10 minutes.
We've brought in the Centers for Disease Control, the national experts in Legionella. They've been here recently. They've been here repeatedly over the last couple of years since the outbreak first occurred in 2015. We've implemented all the changes that the CDC has recommended, but unfortunately, we've still had some incidences of infection. And we can never give up, we can never back down, we can never give in. We've got to leave no stone unturned as we work to prevent any infections at any type at any time. And that's why we're here. We're going to talk more about the incremental, the new things that we're doing. So, CDC said, let's try getting filters on all the faucets and new faucets. We've done it. We've got filters and all new faucets. The CDC said there's a system we can use called bolus, which basically tests the chemicals in the water at local places around the campus, not just where the water comes in, and allows us to put chemicals in to treat the water right at that spot in multiple locations so we can increase the quality of the chemical treatment in the water. So we'll implement that as well. But we want to go beyond that. We want to go beyond what the CDC has recommended and try to do even more to protect our veterans so that we have an intermediate plan and a long-term plan. First, for the intermediate plan, we want to make sure we have options in the coming months for our veterans if the new procedures don't get us where we really need to go. We're going to be monitoring it, but if they don't get us there, we want options. So we are looking very seriously, we're pursuing the opportunity to purchase a nursing home facility right next door and upgrading that, improving the quality and investing in it and upgrading the water treatment systems there as another alternative that we have available for our veterans. And it's right next door. It's called the Sycamore facility, and we're looking at the possibility of acquiring it and upgrading it and using it as an option for our veterans. We're also looking at the option of having modular homes, modular housing that are brand new systems, brand new plumbing, completely separate water systems as another option as well. And those two combinations together are something that we could get done in just a few months rather than years if we need to do that. And we're going to evaluate those options very significantly here in the coming days, and we'll be making announcements on those soon. Long term, our plan is to bring in a planning expert who will work with our campus here and with the Department of Veterans Affairs to plan a whole new facility, a state-of-the-art, super modern facility that will serve veterans here for the next 50 years with the most latest techniques in healthcare providing, as well as mental health treatment, et cetera. So we'll have a world-class new facility here with entirely new systems. That will take a couple years to put in place, but we're starting now the planning process so we can get that going. And we're going to try our darndest to make sure that the bureaucracy doesn't get in our way. We don't want to have a lot of red tape and restrictions, so we're going to be working with the General Assembly to get their support to try to streamline the procurement process and the development process so we can build an ultra-modern facility here in the coming months to serve the next 50 years for our heroes here on this campus. So it's an exciting time, but we've got to move. We can't let any more risk occur here. These Legionella bacteria, they're tough to eradicate, but we will never give up and we'll never give in. We're going to beat them. We're going to keep our veterans safe and healthy and make this the best veterans home in America to protect the health of our veterans. So thank you and God bless you. It's an honor for me to be back with you. I'm going to spend the afternoon with all our veterans and our staff all around the campus. I want to say thank you, and I want to get updates. I'm going to try my darndest, Greg, to see if I can take you in Connect 4. I mean, I'm 0 for 9 on Connect 4, but I'm going to try to do it. And I've been a little busy. I haven't practiced as much as I would like to in the last 6 weeks, but I'm going to try to take them on. But with that, I'll open it up to any questions, either for myself or Mike Hoffman or our team. Any questions?
Has there been money allocated for your short-term and long-term goals? Well,
to do the work we need right now, we have the resources already available. We will be going to the General Assembly. Also, we'll be going to our congressional representatives to get streamlined appropriations as we determine precise amounts that we need. Right now, we don't have a specific ask because we got to make sure we get the exact quantification done, but we'll be doing that shortly.
When do you think that you'll know the amounts and also get some specific answers on when this money will be distributed, so we'll start to see some change?
Yeah. So, well, Mike, I'll let you talk a little bit about the mechanics, and then I'll give a little further answer too.
So the request for proposals for the architecture firm and design firm has been released today. So that's out. There's obviously a bid process. It is a competitive process. We expect to have a contract in place by early summer, if not late spring. We then have a period of time that we have to work collaboratively with the designers to make sure that we know exactly, and with Illinois Department of Veterans Affairs and the Federal Department of Federal Veterans Affairs, to make sure that we have the right plan in place. I expect by sometime this fall, we will have a plan chosen, and we'll be able to work with the federal government and the General Assembly to get money appropriated. As soon as we have a good dollar figure available that we can rely on, we're going to share that certainly publicly, as well as with our friends at the General Assembly.
And when do you know when you would purchase, if you go down this route, the Sycamore?
We have several procedural steps we have to follow, but we have already leaned into some of those, and I expect that we'd be able to close on the Sycamore if we do so in the next month, maybe 2 months.
Is that the plan, though? Or is it just something you're considering?
That is the plan. Obviously, we have not signed a contract. We have not entered into a agreement. We need to do all those steps. We don't want to get ahead of the process, but the plan is to purchase.
Is it a given that it's going to be that you're going to move residents there, or do you have to see a certain test? Do you have to see someone get sick again? I mean, what prompts you to actually make the move to say we are going to relocate temporarily?
As the governor mentioned, we're continuing to work on our water management. We're continuing to take additional steps above and beyond what the Center for Disease Control have recommended, and we'll continue doing that. We'll continue investing in the current homes of these veterans and residents. However, we need to have a contingency plan if indeed we have more infections. That decision we need to be made in concert with our Department of Public Health, in concert with Veterans Affairs, as well as in concert with other medical professionals who can let us know risk versus gain of moving. But we're going to have the option in place as quickly as we can.
Senator Durbin sent out a news release about an hour ago criticizing the Rauner administration for not acting swiftly. What would be your response to Senator Durbin and the news release and the allegations?
I'll react. I think it's not appropriate to play political football with this important issue of our veterans' health. We have acted promptly and effectively, implementing every recommendation that the national experts have recommended that we do. And there's this false narrative, I think, for political purposes, that somehow it's too slow or why did it take so long. Nothing has taken long. We've implemented immediately everything that's been recommended. So there is nothing that's somehow taken too long or that we didn't do or we waited on. Nothing whatsoever. We have the national experts here. They were just here again recently. They are surprised. The CDC is surprised because we've done everything right immediately when we should have. They're surprised. This is unprecedented. This is very unusual circumstance. They've acknowledged that. That's why we are going even above and beyond what the CDC has recommended, and we are not going to wait for anything. We're going to act immediately, and we have an intermediate plan and a long-term plan. Moving, some people have said, well, just move the veterans out. Moving is extremely high risk. These are vulnerable residents with fragile health. Movement, completely different facility, a completely different town, different area, remote from their families, very high risk for the veterans' health. No expert has advocated massive movement or massive evacuation of the home ever. And we are committed to not doing that because it has its own very high risks. But we do need to have options available if for some reason all the new steps we're taking aren't as effective as we want them to be and as we need them to be. The CDC has said you can never have 100% eradication. It's not possible. And unfortunately, Legionella is prominent all around the water systems in the state of Illinois and frankly across America. And cases of Legionella infection are rising around the nation because we're more sensitive to it now and we're testing for it. But we here in Quincy at this Veterans Home are committed to reducing the risk as far and as low as we possibly can and keeping our veterans safe and healthy in a very loving and nurturing home. And that's what we're going to do.
What's your reaction to the legislation that's recently been filed involving this facility? What's your reaction to that?
Well, I appreciate the efforts of and the interest of the legislature to try to be helpful. And to the degree we'll study the legislation, we'll work with members of the General Assembly. As long as we keep political football out of it and grandstanding and yelling for headlines and just focus on what's best for the veterans. That's all I care about. I've been a veterans advocate my whole life. All I care about is that our veterans are well served and protected. As long as everybody has goodwill and good faith to do that, we'll get to the right place. We're implementing everything we can immediately, and now we're going to take it to the next level, and we're going to get a world-class facility here for the long term.